Dr. Stanford grew up in the Otis area, graduating from Otis High School. She is a board-certified pediatrician, graduating from Colorado State University with honors. Dr. Stanford attended the University of Colorado Medical School before completing her pediatric residency at Children's Hospital in Denver. While at Children's, she served as a chief resident. Dr. Stanford has a private practice in Aurora, Colorado, and is a regional director from Colorado on the National Catholic Medical Association Board. For the past 2 years, Dr. Stanford has testified before the Colorado State House and Senate committees concerning the physician-assisted suicide propositions. Dr. Stanford lives in Littleton, Colorado with her husband and 3 children. Dr. Stanford.
Thanks, Leland. My daughter's actually here with me today, so I had drug her around to hear all of this. So, as Leland said, I did all my training here in Colorado, so I am proud to call myself a Coloradoan. And actually, before I get started, I wanted to thank Senator Sonnenberg. As Leland talked about, I spoke in the House and the Senate, and he voted in the committee, helped defeating the measure in the Senate. So I'd like to thank him for that. I am here to urge my fellow Coloradoans to oppose Proposition 106 on physician-assisted suicide. As a physician, I am very distressed by this ballot initiative. Any law that would permit a physician to hasten a patient's death is dangerously fatal to Coloradoans and undermines the integrity of the medical profession. As the American Medical Association states on physician-assisted suicide, quote, allowing physicians to participate in assisted suicide would cause more harm than good. Physician-assisted suicide is fundamentally incompatible with the physician's role as healer, would be difficult or impossible to control, and would pose serious societal risks, end quote. If voters allow physician-assisted suicide to be legalized in Colorado, have you considered the impact that would have on the citizens of Colorado? I'm going to pose 5 questions for you to consider when you're voting for Proposition 106, and while I think that this bill is fatally flawed and would be detrimental to our good state and have many unintended consequences. First question, if Colorado adopts this proposition, would the overall suicide rate in Colorado increase? Under this proposal, understand that any death attributed to physician-assisted suicide is not counted in the state's suicide statistics. The death certificate is actually stated that their death was related to whatever illness they had. So because the proponents of this proposition understand that society does not condone suicide as an acceptable event, the name it does not include the word suicide. The definition of suicide in the dictionary does not list what your cause or your intention at the time of death, but only that your death was intentional. Currently, Colorado is experiencing epidemic rates of suicide. As a pediatrician on a regular basis, I see adolescents in my office contemplating suicide. And currently, the second leading cause of death for children aged 15 to 24 is suicide. Colorado has the 5th largest or highest suicide death rate in the country. Starting 2 years after doctor-prescribed suicide was legalized in the state of Oregon, the suicide rates skyrocketed, increasing by 42%. We already have a higher suicide rate than Oregon. Do we also want to be known as the suicide state? Proposition 106, which is similar to Oregon's law, is also being considered at a time in Colorado where people die more from suicide than motor vehicle accidents or homicide. Why would we want to increase the number of suicide rates in our states and expose our teens and families to even more of it? Number 2, can doctors accurately assess how long someone has to live from a terminal illness? Have you or any of your family or friends been given a diagnosis or treatment by a physician that was either wrong or altered at a later time? The fact is that doctors can be wrong, and we're not very accurate at determining the length of time a person has left to live. In Colorado, hospice discharges between 5 and 20% of their patients. To enter hospice, you have to have a terminal diagnosis and have 6 months left to live. So they discharge up to 20% of those patients because their conditions improve or the diagnosis or prognosis was wrong. I have an example of that in my family. I have a dear friend of mine whose name is Jim, who suffered a brainstem stroke and ended up living 10 years after he entered into hospice, was discharged from hospice after his 6 months time was up, and lived 10 more years. During that time, he saw his daughter married, 2 of his grandchildren born, a grandchild graduated from high school, many memories with his family that he was able to have. And he truly treasured every minute he had. I'm sure many of you have similar stories. Number 3, do you trust insurance companies and government bureaucrats to do the right thing rather than the cheap thing? When faced with the choice of legalizing physician-assisted suicide, we have to keep in mind the environment of cost containment. Insurance programs have incentives to cut costs, especially in the last 6 months of someone's life when they end up spending the majority of their costs. Simply denying claims for therapies and treatments or delaying therapies and treatments that someone may need and want may be enough to force a person into choosing death over life. This actually happened in Oregon. There's a couple of cases that have been listed. One particular woman by the name of Barbara Wagner, who was 62, had a terminal diagnosis of lung cancer. It actually recurred. It was in remission, and it recurred. She received a letter from Oregon's state-run health plan denying her further chemotherapy, but offered to cover her assisted suicide treatment. At less than $300, the assisted suicide is, to put it bluntly, the cheapest treatment for terminal illness. If life-sustaining expensive treatment is denied or even merely delayed, patients may be steered toward assisted suicide where it is legal, thus removing choice from patients. Many people say it's my right, but it removes choice. It actually becomes a duty. When something becomes a law and the government's involved, it can be infringed on others. It's an illusion of choice, and it actually restricts choice. The proponents of this bill understand the economics of physician-assisted suicide. Derek Humphreys, who's one of the co-founders of the Hemlock Society, which is now called Compassionate Choices, which is the primary funder of the current proposal, stated, "In the final analysis, economics, not the quest for broadened individual liberties or increased autonomy, will drive assisted suicide to the plateau of acceptable practice." Number 4, is it compassionate to end someone's suffering by eliminating them? There are more compassionate and empathetic ways to address the needs of the terminally ill. Compassion is our top priority as physicians. When treating the terminally ill or those who are in pain, we should never suggest that prescribing death is the most compassionate choice. There is a better way. This is not about forced continuation of unnecessary medical care or keeping someone alive at the end of their life on life support. Hospice and palliative care, as well as letting our loved ones know that they're not a burden to us when they are sick. There are more compassionate alternatives to ending someone's life with assisted suicide. Many people think that physician-assisted suicide is necessary to prevent pain and suffering at the end of their life. When people suffer from a terminal illness, they are more concerned about being a burden to others than their own suffering. Available data, again from Oregon, states that uncontrolled pain is rarely the reason that physician-assisted suicide is chosen. The top 2 reasons, the first is that they don't want to be a burden on their family, and they're afraid of being disabled or dependent on others. What if you found out that your elderly mother's doctor prescribed assisted suicide for her, even though she didn't have serious physical symptoms of her illness, but wanted to die because she was worried that she was a burden to you and her family? Reason number 5, Why are people with disabilities and other people with vulnerable conditions, such as depression and disabilities, worried about physician-assisted suicide? The legalization of assisted suicide may appear acceptable when the focus is solely on the individual. But it is important to remember that in doing so, we have repercussions all across society, and it puts other people at immense harm. Abuse of people with disabilities and elder abuse are on the rise. An heir or an abusive caregiver may steer someone towards assisted suicide. They may witness the request. It states that there may be 2 witnesses. Only one of them can't be the heir, but the other one can. So they still could be the heir of their estate. They may even give the drug. No witness is required at the time of death, so who would know? People with mental illness and depression have been given the prescriptions in Oregon, despite the claims that proponents claim that these conditions disqualify a person. This proposed ballot initiative must be defeated. Transforming the crime of assisted suicide into a medical treatment is not compassionate and would have an impact on all in the state of Colorado. Proposition 106 is fatally flawed. I encourage you to ponder the detrimental effects that this law would have on the citizens of Colorado that I've posed today. If Colorado adopts Proposition 106, will the overall suicide of Colorado increase? Can doctors accurately assess how long someone has to live from a terminal illness? Do you trust insurance companies and government bureaucrats to do the right thing rather than the cheap thing? Is it compassionate to end someone's suffering by eliminating them? Why are people with disabilities and other people with vulnerable conditions such as depression worried and opposed to physician-assisted suicide? As a physician, I prefer to continue caring for my patients and family with true compassion and empathy, and honor the first principle in medicine, which is to first do no harm, and help maintain the integrity of my medical profession. I am voting no on Proposition 106. If you have any questions, I'd be happy to answer.